GP practices provide services for the NHS which the public can attend without referral, and so they are truly at the heart of primary care. However, practices are often under a huge amount of pressure, and unfortunately, some do have to close. For the organisations who support the practices, the Integrated Care Boards, or ICBs, this provides a serious problem. Steve McInnes, Head of Primary Care Commissioning in Hampshire and Isle of Wight ICB, faced this problem for one of their practices. It's vital that patients continue to receive services, that they're given a choice so that health inequalities are avoided and that fair and accountable decisions are made. So what could Steve do to help solve this? Patients of the closing practice can be taken on by neighbouring practices, but only if the practices have capacity and the patients reside within their contractual boundaries. This is where SCW comes in. Our geospatial team use their skills and experience, as well as their geospatial mapping system, ArcGIS, to ensure the best outcomes are available. In Steve's case, we first used mapping to agree on the correct boundaries. We ran travel analyses of the time taken for patients to get to each practice to make a sensible estimate of the demand on each of the candidate neighbouring practices. This is essential for agreeing on how many patients each practice would be prepared to take on. Our ArcGIS systems technology was used to offer each patient options from a list tailored to their location. Patient location, practice boundaries, survey responses from affected patients, and travel times are used in a dispersal model to plan the reallocation of patients, with each step being agreed with the ICB. Crucially, our support has helped to reassure Steve and to ensure that patients and their views were at the centre of any decisions about what happens because of a practice closure. It's important to inform patients about what's happening and to do everything possible to present them with choices. Our geospatial input enabled Steve and Hampshire and Isle of Wight ICB to consider all the options available and to understand patient views through the survey facility, then make fair and defensible decisions about what would happen to the closing practice's patients.
We had a practice closing with around 9,000 patients, and the team were absolutely brilliant in supporting us through the whole process. They did a whole review of all the practice boundaries, so we knew which patients could transfer to which other surgeries. They designed and ran a patient survey for us, which we had a really high success rate with in terms of feedback from patients. And they helped support us with the actual bulk transfer of patients, getting those people to new practices in the area. So it was a great working with the team. They were really helpful, and I don't think we could have done it without them.